More than 1.8 million people in the U.S. are diagnosed with some form of cancer every year. And even though survival rates are up, disparities still exist. According to the American Cancer Society, African American people have the highest death rate and shortest survival of any race or ethnic group in the United States. And that's the case for most cancers. Now, Dr. Pooja Advani, a hematologist and oncologist with Mayo Clinic Comprehensive Cancer Center, joins us via Zoom this morning. So first off, good morning, doctor. Thank you for being here.
Good morning. Thank you for having me.
And I just want to jump right into it. I want to talk a little bit about that disparity. Can we talk about why the rates are so high for African American people?
Yeah, that's a really good question. I know that, we've made several advances in cancer outcomes, but unfortunately that has not equally benefited all women. We know that African American people are more likely to be affected by aggressive forms of breast cancer, such as the triple negative breast cancer, as we call it. They are likely to be diagnosed at younger ages and unfortunately with more advanced stages of disease. The reasons behind this disparity are rather complex and it may be due to a variety of factors, such as social factors, economic factors, access barriers to cancer care. But there are also differences in cancer biology. And that means that there are drivers of cancer that could be different amongst racial groups. For example, between Caucasians and African American patients.
So what can people do to kind of avoid that and heighten their chance of survival?
Absolutely. So I think it's very important for all women of color to get screening mammographies regularly. We also have the responsibility as physicians in the cancer research community to ensure diversity in cancer research. Every person's cancer is unique. So what causes it to grow and divide is unique. And so a better understanding of that will allow us to give the right treatment to the right patient. And we largely learned this from doing clinical trials, which have historically included white women. So in order to actually improve the outcomes of African American patients, I think it's absolutely critical to increase their participation in clinical trials. So this will allow us to really learn what is unique about their cancer, what causes their cancer to grow, so we can accordingly devise treatments to improve their outcomes.
And when do you know when you should see a doctor? Because sometimes people may have something in their body that doesn't feel right, but they're like, oh, okay, that can't be me. I'm too young for this.
Absolutely. No one is too young for cancer, unfortunately. So I think having a heightened awareness of the signs and symptoms of cancer. So that starts by good education, having, a relationship with your primary care physician or other specialists, such as gynecology, for example, and bringing to their attention any abnormalities that they either feel or they can palpate, which is, feel an abnormality on their body, their breast, their underneath their armpit, to their physician's attention right away and allow the medical personnel to guide them for appropriate diagnosis.
But we know overall cancer deaths have dropped about a third. What advancements have helped that decline?
Great question. So I think firstly, the cancer detection techniques have really advanced. So it allows us to detect cancer accurately and in a timely manner. Again, patients are more aware of the symptoms of cancer and cancer screening methods that are available out there. So that has helped. But definitely we've made a lot of progress in treating cancers. This includes personalized cancer treatment techniques and then things such as immunotherapy, for example. So that is harnessing one's own immune system, making it stronger to go and fight the cancer. So this includes certain IV medications. It includes cancer vaccines. It also includes certain techniques where I can take important components of the immune system and then train them outside the patient's body to fight the cancer better and then reintroduce them back into the patient's body.
Such an important topic. Thank you so much, Dr. Advani. It was a pleasure having you on this morning.
Thank you for having me.